Hello and welcome to our special session on the basics of Medicare. I'm Niki Trentacosta, your guide and expert at the Tanna Group. Whether you're nearing 65 or have already celebrated your birthday, understanding Medicare is crucial for your healthcare journey. Today, we're diving into the essentials of Medicare, breaking down its complexities to make your choices clearer and more manageable. Our journey today is not just about facts. It's about empowering you to make the best healthcare decisions for your future. Let's start with a little about us. The Tanna Group stands at the forefront of healthcare consulting with a focus on Medicare. Our journey began with a simple vision to demystify the complexities of health insurance. For over 15 years, we've been guiding individuals like you through the maze of healthcare. Our approach is personal, our expertise is deep, and our commitment is unwavering. We don't just offer advice, we build lasting relationships to support you at every step of your healthcare journey. What drives us at the Tanna Group? Two things, our vision and our mission. Our vision is a world where healthcare decisions are clear and accessible. We strive to turn the often confusing world of Medicare into a clear path for your health and well-being. Our mission is simple, yet profound, to provide you with understandable, tailored healthcare options. We believe encouraging you with knowledge, equipping you to make informed decisions about your Medicare coverage. Now, let's talk about Medicare. It's a health insurance program run by the federal government. Specifically, the Department of Health and Human Services oversees the Centers for Medicare and Medicaid Services, or CMS. This is primarily for people aged 65 or older, or sometimes it's available to individuals with certain disabilities and people with end-stage renal disease. Generally, if you're 65 or older, you qualify for Medicare. Now, enrollment timing is key. Your initial enrollment period begins 3 months before you turn 65 and ends 3 months after your 65th birthday. Enrolling during this window is vital to avoid late penalties and ensure your coverage starts when you need it. Additionally, there are special enrollment periods throughout the year based on many different scenarios. Understanding Medicare can sometimes feel like learning a new language, so let's help navigate our journey. Let's clarify some key terms that you'll often encounter. These 7 terms are essential to grasp as they form the foundation of your Medicare knowledge. We discussed enrollment eligibility in the last slide. Next is government or private. This refers to who manages the claims. Original Medicare Parts A and B are run by the federal government, while Parts Medicare Supplement, Medicare Advantage, and prescription drug plans are all run by private insurance companies, but are regulated by CMS. Inpatient, outpatient describes the care you receive. Inpatient care involves an overnight stay in a hospital, while outpatient care includes services where you're not admitted in the hospital, like doctor's visits, scans, and same-day surgeries. The term network is fundamental for Medicare Advantage plans. A network is a list of doctors and hospitals and other healthcare providers that your plan has contracted with to supply medical care. There are different types of networks in the plans, including HMO and PPO options available. Moving on to the financial part of the definitions, the deductible is the amount that you pay out of pocket for your healthcare before your insurance starts to pay. It's a set figure you need each year before the insurance kicks in. Once you've hit your deductible, the coinsurance is the share of the cost of any covered services. It's usually a percentage, and it kicks in after you've paid your deductible. Finally, the out-of-pocket maximum. This is the most that you pay for covered services in any plan year. After reaching this limit, your plan pays 100% of the covered services. Understanding these terms will help you better understand the specifics of your Medicare plan and help you make informed decisions about your healthcare. Remember, the right knowledge is a powerful tool in managing your health and well-being. Now, let's begin our journey through the parts of Medicare. We will begin with Medicare Part A, commonly known as hospital insurance. Part A is a fundamental part of Medicare, and it covers inpatient care. What does this mean for you? Well, if you need to stay in a hospital, use a skilled nursing facility, require hospice or certain home health services, Part A is here to help cover these costs. A key point to remember about Part A is for most people, it's premium free. If you or your spouse have worked and paid Medicare taxes for at least 10 years, you won't have to pay a monthly premium for this coverage. This is a significant benefit as it helps reduce your healthcare costs in retirement. However, there are still out-of-pocket costs to consider. For instance, there's a deductible of $1,632 for each hospital stay. You must understand that this is not an annual deductible, but rather it applies to each time you're admitted into the hospital. And while there's no coinsurance for those first 60 days of a stay, longer stays will likely incur added costs. Part A is quite comprehensive for inpatient services. However, it does not cover long-term or assisted living care, so consider planning accordingly. Part A is the base of your Medicare coverage. It's also the starting point for considering added coverage options such as Medicare supplement plans, Medigap, or Medicare Advantage plans, Part C, which we'll discuss later in this presentation. Second, let's explore Medicare Part B, also known as the medical insurance portion. This part covers your day-to-day healthcare needs. Part B is designed to help you with the costs of services from doctors and other healthcare providers, outpatient, also known as outpatient care, home health care, durable medical equipment, and some preventive services. Unlike Part A, most people pay a premium for Part B through your Social Security account or wire transfer. The standard premium amount in 2024 is $174 per month, but this can vary based on your income level. This concept is known as the Income-Related Monthly Adjustment Amount, or IRMA. In other words, if your income is higher, you might pay more for Part B. Another important aspect of Part B is the annual deductible, which is $240 per year. After you reach your deductible, Medicare typically pays 80% of approved services, and you're responsible for the remaining 20%. This 20% is called your coinsurance and should be factored into your healthcare budgeting. Note here that there's no network for Part B, so this means that you can visit any doctor in the United States that accepts Medicare. This offers a great deal of flexibility, allowing you to choose the providers that best meet your healthcare needs. Understanding Part B is key to effectively managing your medical expenses. While it covers a wide range of services, remember that it doesn't cover everything. Services like routine vision and dental care, hearing aids, and long-term care are not covered under Part B. It's essential to consider these limitations when planning your healthcare. Let's look at some options to meet these needs now. Medicare Part D is a prescription drug coverage. This part of Medicare is essential for anyone who needs medication regularly. Unlike Parts A and B, Part D is offered through private insurance companies and is regulated by CMS. Here's what you need to know about Part D. The costs for Part D plans vary tremendously, but on average, the monthly premium is anywhere between $1 and $35 a month. However, this can differ based on the plan you choose, your income level, and your geographic area. Remember, if your income is higher, you might pay more due to the income-related monthly adjustment amount. Each plan does have its own set of deductibles and coinsurance, and they'll vary depending on the medications you need and the specific plan that you select. Also, Part D plans often have preferred pharmacies, which means you get the best rates on medications when you use these pharmacies. Be sure to check whether your preferred pharmacy is in a plan's network before enrolling. Now, for some good news. There are limits on how much you're subject to pay out of pocket each year for medications. In 2024, the maximum out of pocket is $8,000. But thanks to the Inflation Reduction Act, in 2025, the annual out-of-pocket max is going to be capped at $2,000 for prescription drug coverage. Finally, just like with other parts of Medicare, you have specific enrollment periods. It's important to enroll in a Part D plan when you first become eligible to avoid late enrollment penalties. For example, if you don't sign up for Part D when you're first eligible and don't have other credible drug coverage, you could face a 1% penalty for each month that you were eligible but didn't enroll. This follows you for your lifetime. Now, understanding Part D is pivotal for managing your medication costs. It's all about finding the right balance between premiums, deductibles, and out-of-pocket costs while ensuring your medications are covered. As always, review your Part D coverage annually as your plans and medications needs can change. As we navigate further into Medicare, let's discuss Medicare supplement insurance. This is also often known as Medigap. These plans are labeled as Parts E through N. Medigap plans are offered by private insurance companies. So we've got CMS regulating us here, and are available to anyone enrolled in Parts A and Part B. Here's a brief overview of what Medigap covers. Medigap plans help pay for some of the healthcare costs that original Medicare doesn't cover, such as those co-payments, co-insurance, and deductibles. Like original Medicare, Medigap plans typically don't have a network, which means you can use any doctor or hospital that accepts Medicare. The different plan letters, E through N, offer varying levels of coverage, but are all standardized by the government. So each plan design is the same, but the price may change between carriers. Plan G is a popular choice as it offers comprehensive coverage, only leaving out the Part B deductible. Premiums for Medigap plans can range from $50 to $400 a month, depending on the plan and where you live. The last part of Medicare that we'll be exploring today is Medicare Part C, also known as Medicare Advantage. This is an alternative to original Medicare and is offered by private insurance companies that are approved by Medicare. Medicare Advantage plans bundle Part A, your hospital, Part B, your medical insurance, and often include Part D, your prescription drug coverage as well. This makes it a convenient all-in-one choice. Many Medicare Advantage plans offer extra benefits not covered under original Medicare, such as vision, dental, hearing, and more. This can be a significant advantage if these are services that you need or predict needing. One key thing to remember about Medicare Advantage plans is that they usually have a network of doctors and hospitals. This means you may need to see healthcare providers within the plan's network to get the lowest out-of-pocket costs. It's vital that you check whether your preferred doctors and hospitals are in a plan's network. While many Medicare Advantage plans offer $0 monthly premiums, it's vital to look at other costs like copays, deductibles, and out-of-pocket maximums. These costs can vary widely between plans. Also, you must be enrolled in Medicare Parts A and B in order to join a Medicare Advantage plan. And you can only switch, join, or drop a Medicare Advantage plan at certain times of the year, typically during the annual enrollment period from October 15th to December 7th. When considering Medicare Advantage, think about your healthcare needs and lifestyle. If you prefer having your care coordinated and don't mind having a more limited network of providers, Medicare Advantage might be a suitable choice for you. In summary, Medicare Part C offers a way for you to receive your Medicare benefits through private insurance plans with added benefits and potentially lower out-of-pocket costs, but with some network restrictions. It's a great option for those looking for comprehensive coverage and added benefits, as long as you're comfortable with those network limitations. Now that we've explored the distinct parts of Medicare, you might be wondering, how do I choose the best option for my needs? This is a crucial question, and the answer is unique to everyone. As we transition into the next part of our presentation, we'll focus on how to select the Medicare plan that aligns with your specific healthcare requirements, lifestyle, and financial situation. Our goal is to equip you with the information necessary for you to make an informed decision. It's all about balancing cost, coverage, and convenience to find a plan that offers you peace of mind and meets your healthcare needs. Remember, there's no one-size-fits-all solution in Medicare. Let's delve into option 1 for your Medicare choices, which is enrolling in only Original Medicare. This means that you enroll in Medicare Part A, your hospital insurance, which is generally premium free. Remember, the deductible is $1,632 per hospital stay, and there's no coinsurance for that first 60 days. And you enroll in Medicare Part B, which covers your day-to-day medical needs. Most people pay the standard $174 monthly premium, and Part B comes with that $240 annual deductible and the 20% coinsurance. Original Medicare supplies broad coverage, but it doesn't cap the out-of-pocket expenses associated with your healthcare. This is a major factor to consider, especially if you have frequent medical needs. No out-of-pocket max. In summary, option 1, Original Medicare, offers comprehensive hospital and medical coverage. It's a solid base for your healthcare needs in retirement, especially if you value flexibility and choice in your healthcare providers. Option 2 for your Medicare coverage combines Original Medicare with a prescription drug coverage, also known as Part D. Let's break down what this option offers. Just like option 1, you enroll in Part A and Part B. But this is where option 2 differs. You then enroll in a Medicare Part D prescription drug need, and this is essential for those who need regular medications. The average cost for Part D, remember, can range between $0 and $35 a month, but can vary based on the plan that you choose. To summarize, option 2 offers broad coverage of Original Medicare with the added benefit of prescription drug coverage under Part D. It's a suitable choice for those who need regular medications and prefer the flexibility of Original Medicare. Let's explore option 3, which combines Original Medicare with prescription drug coverage and a Medicare supplement, also known as Medigap. This choice provides a comprehensive approach to your healthcare coverage. As with the other options, you enroll in Parts A, B, and D. But here's where option 3 stands out. You add on a Medigap policy, which is sold by private insurance companies and helps pay for some of the healthcare costs that original Medicare doesn't cover, like those copayments, the coinsurance, and the deductibles. Medigap policies come in distinct types named E through N and offer various levels of coverage at varying costs. Remember, example plan G is the most popular choice for its comprehensive coverage. The premiums for Medigap policies can range from $50 to $400 a month. Closing out, this slide offers extensive coverage by combining original Medicare's comprehensive benefits with the added security of Medigap and the prescription drug coverage of Part D. It's an excellent choice for those seeking peace of mind and predictability in their healthcare expenses. Finally, let's discuss option 4, which is Medicare Advantage or Part C. This option offers an alternative to original Medicare and is provided by private insurance companies which have been approved by Medicare. Medicare Advantage plans bundle Part A, Part B, and usually Part D. This means that you get all of your Medicare coverage through a single plan. One of the major attractions of Medicare Advantage plans is that they often include benefits not covered by original Medicare, such as dental, vision, and hearing services. These extra benefits can supply significant value depending on your personal health needs. While many Medicare Advantage plans offer that $0 monthly premium, you will be subject to costs like deductibles, copayments, and coinsurance. These plans also have an out-of-pocket maximum, which can supply peace of mind by capping your potential expenses. So, you've made a Medicare choice, but what if your needs or preferences change? Let's discuss the flexibility and considerations of changing your Medicare plan. The good news is that Medicare offers an annual election period, or AEP, that runs from October 15th to December 7th each year. This time, you can switch between Medicare Advantage and Original Medicare, change Medicare Advantage plans, or add or drop Part D coverage. This period allows you to adjust your plan based on changes in your healthcare needs or financial situation. Here's a key point to note about Medigap policies. When you first enroll in a Medicare Part A and B, you have what's called a Medigap open enrollment period. During which insurance companies can't deny you coverage or charge more due to pre-existing conditions. In conclusion, it might seem logical to enjoy the cost savings of Medicare Advantage plan while you're healthy and then switch to Original Medicare if your health needs change. However, keep in mind that switching back to Original Medicare might not guarantee you the same choices or costs for Medigap coverage as when you first became eligible. We have covered a lot of ground, from understanding the distinct parts of Medicare to exploring the diverse options available to you. It's okay if you still have questions or feel uncertain about your choices. That is completely normal. Our goal is to ensure that you feel informed and confident in your healthcare decisions. You see, each of you has unique healthcare needs and circumstances, and we are here to help provide personalized aid, whether it's helping you compare plans, understand coverage details, or simply offering a listening ear for your concerns. As we come to the end of our journey through Medicare, I want to extend a heartfelt thank you for your time and attention today. Navigating Medicare can be complex, but remember, you're not in this journey alone. At the Tanna Group, we're here to help support and guide you every step of the way. Please feel free to contact us at thetannagroup.com for any further help. You can visit our website, give us a call, or schedule a one-on-one consultation. We are here to help you make the best Medicare choices for your lifestyle and health.